Great to see you, Madam Chair, and thank you so much to you and the ranking member for holding this critical hearing on the Affordable Care Act. I've said it before, I'll say it again. Across this country, 135 million people under the age of 65 have a pre-existing condition. So we know the total number is much, much higher. In New Hampshire, over 500,000 Granite Staters, and that's over half the population that are non-elderly, live with pre-existing conditions every single day and could be denied access to health care either prior to the passage of the ACA or if the ACA is repealed by the Supreme Court. As we now know, our Republican colleagues are rushing to make happen. So even today during this pandemic, COVID-19 would be a pre-existing condition for an additional 7 million Americans. That's why I introduced the Protecting Americans with Pre-Existing Conditions Act, which has passed the House twice and still sits on Mitch McConnell's desk. And I want to particularly address my colleague, Mr. Carter, who said that Democrats are trying to create an illusion that Republicans oppose protections for pre-existing conditions. It's no illusion, Mr. Carter. You and your colleagues have voted twice against my bill, and it's very clear that you do not want to protect Americans with their pre-existing conditions, even COVID-19. Despite what this administration has claimed, this administration does not support protecting Americans with pre-existing conditions. They haven't supported it when they encouraged repeal and replace without a replacement plan, or when they issued destructive guidance through the 1332 waivers, or when they fight in the courts to dismantle the entire law. And we now know that that hearing is coming just 1 week after the election in November. This is dangerous and destructive to the lives of the American people. They certainly have not supported the ACA in the midst of this global pandemic, which has needlessly taken the lives of now over 200,000 Americans. And because the stark reality is that every year of the Trump administration, the rate of Americans without health insurance has increased, this year has proven no different. So today I will focus my remarks on the ways this administration has continued to sabotage the ACA. Over 40 million Americans have filed for unemployment benefits during COVID-19. Millions of Americans and their families have lost job-based health care, and yet this administration refuses to establish a broad special enrollment period, which would allow uninsured Americans to sign up for coverage in the federal marketplace. It's especially critical in states like my own that depend on the federal government as a partner in the ACA marketplace. So, Dr. Summers, most state-based marketplaces establish broader enrollment periods. Can you briefly discuss how enrollment in state-based marketplaces has compared to the federal marketplaces like our own right here in New Hampshire?
Yeah, so 12 of the 13 states that fully run their own marketplace have created COVID-specific special enrollment. And what you can see in the enrollment statistics that are available through the middle of the year is that there's been about a 15% increase over the open enrollment totals in those states. And that compares to just 11% in the states that are on the healthcare.gov platform. And note, the ranking member asked about flexibilities. More than a dozen states on the healthcare.gov platform requested that flexibility to create a new special enrollment period for COVID, and so far CMS has not granted that.
And Mr. Lee, Covered California established a special enrollment period for COVID-19. How many individuals signed up for coverage during this period?
Yeah, about 300,000. And I'll underscore, it's both a special period because 20% would have been ineligible and they were healthy, needed coverage, but the rest were eligible but needed marketing, needed to be told to come in the door, and they doubled our enrollment from the prior period.
And based on your analysis, how many individuals could have gained coverage if the federal marketplaces experienced the same level of growth as your state did during this special enrollment period?
Yeah, our analysis is if the federal marketplaces had done what we had done, 500,000 Americans would not be uninsured today. They'd have insurance during a pandemic when you want them to have insurance to be able to get tested and get the care they need.
Madam Chair, I apologize. I've lost the clock on my screen. Should I yield back, or if I have?
Well, my clock has zeros going
All
across.
right, I will yield back and submit my questions. Thank you, Madam Chair, for your patience.